I have been asked to talk about today is how to patent Intellect. But before we get on to that, I think a much more interesting and relevant and provocative question is why? Why do we want to patent Intellect? So just to backtrack and remind ourselves, a patent is a monopoly granted by a state in exchange for full disclosure of an invention, whatever that might mean. It generally lasts for 20 years and is issued territorially around the world. So why would we want to do this? We are told frequently and from a number of sources that the 21st century is the open source century. Free exchange of ideas is the way that things are done at the moment. In software, in genetic research, it is the free exchange and sharing of ideas that is the core of 21st century creativity. On the other hand, patents are a monopoly. And we all know that monopolies are evil, don't we? If you've ever played a game of Monopoly, you can realize quickly how evil people can be. Second to none as a way of falling out with your family. But what I'm going to show with a couple of examples is that in certain fields of technology, patents can provide a unique opportunity for bringing life-changing, life-saving inventions and innovations to the public who are then ultimately able to benefit from them. The first story I'm going to tell you is it's not about patents at all. In fact, it's about the opposite. So this is an invention that was kept secret for a long, long time. So on the slide here, I've shown a very early pair of obstetric forceps. Obstetric forceps are an invention that has saved hundreds of thousands of lives over the course of several centuries. So an obstetric forceps prevents one of the most common causes of neonatal and perinatal death, which is obstructed birth. So the baby becomes stuck in the birth canal, it becomes distressed, and the usual outcome is that either the mother or the baby, or sometimes both, do not survive the birth. So with a pair of obstetric forceps, the key point is that each of the blades, the leaves of the instrument can be inserted separately into the birth canal. The fulcrum can then be engaged. The baby's head pressure can be applied to the baby's head, and the baby can be safely delivered. So it is a giant stride forward in the field of obstetrics. I mean, it's decreasingly used these days because of alternatives and safe cesarean sections and things like that. But the obstetric forceps were invented in England in the 17th century by a family of obstetricians called the Chamberlains. And the Chamberlains invented the obstetric forceps, and they kept it in strict secrecy for 5 generations of the family. So that all the family were obstetricians, and each time the forceps were used, they were kept in a hidden compartment in the family house. When a mother was in labor, they were taken from the compartment, put in a giant box, which was carried by 4 men, so people thought it was a very, very large contraption. The laboring mother was blindfolded, so she couldn't see what was happening. The baby was delivered, and then it was returned to the secret compartment in the family home. And the family successfully maintained the secrecy of the obstetric forceps for over 100 years, which was great for them because they had an unrivaled success record in safe delivery of babies. It was great for the mothers that they were able to help, but it was bad for society because obstetric forceps never came into wider circulation. They were never disseminated in the obstetric community, and they never saved hundreds of thousands of lives that were subsequently lost. And this is the problem that the patent system is intended to address. The Chamberlains would have been rewarded with a monopoly in which they could have exploited their invention and licensed it or whatever. And then after 20 years, everyone would have been free to use it. So talking now about the situation in the United States. In the 1970s, it was widely perceived that there was a period of economic malaise and stagnation. And it was decided that something had to be done to address this. And prior to 1980, the situation was that billions and billions of federal dollars were spent on research in US universities. So inventions were made all the time. And the law was that all inventions made in universities were owned by the US government. And you could apply for a license to work one of these inventions, but only on a non-exclusive basis. So if you came to me for a license, I could grant you a license, but I would have to license it to anyone else who wanted a license. So prior to 1980, there had been no medicines which had made it to the market as a result of research conducted in United States universities. None. In 1980, the situation changed. They implemented a piece of legislation called the Bayh-Dole Act, which said that universities and other federally funded research institutions could keep the intellectual property that they generated. And moreover, they were able to license it exclusively. So they were able to license to one single company the inventions that they produced. Since 1980, 136 medicines have been commercialized as a direct result of US research carried out in universities, just because of that one change from the entitling the universities to keep and benefit from the research that they conducted. Hundreds of thousands of jobs have been created on the back of this. Tens of thousands of small companies, many of which are still in operation, have been started out, so-called spin-out companies. And billions of dollars have been returned to the university by virtue of royalties. So in these circumstances, what are the lessons that we can learn? So patents enable the public to benefit from the invention. So these inventions that we're talking about, healthcare, other fields of technology, they require large amounts of investment in order to put them in a state where they can be commercialized. So for a typical medicine, various figures are quoted, but $500 million to bring that product to the market is not unusual. Without a realistic prospect of commercial return, no one will invest that money. Okay, so if you say you've invented a drug and it needs a further $200 million to spend on it before it's safe and approved for human use, unless you have a strong patent position, you will never get the funding you need to bring that to the market. So this is what patents are intended to provide. They provide a time-limited monopoly in exchange for full disclosure. They provide confidence to the investors that they can, not necessarily will, it's still a big gamble, that a return can be generated, and they enable the public to benefit from the invention. So this is the main point from society's perspective. The main point of the patent system is not to make money. You know, it's nice for somebody if money can be made. But the main point is to bring inventions to the benefit of the public. So having a patent puts you in control of your technology. So remember the example we talked about with the obstetric forceps and the Chamberlain family. They went to these extreme lengths to maintain secrecy. If they had had a patent covering the invention, they would automatically have been in control. And if they were in control, they could do whatever they wanted. So they could say, yes, we're giving a free license to everybody, okay? You can share your invention. You can give it away. You can pool it with other patents, and the pool can be licensed to people on whatever criteria. And of course, without money, very few things in the world are possible. And generating money on the back of patents is a recognized and legitimate activity. So the final story I want to tell you about relates to this extremely distressing condition which is prevalent in sub-Saharan Africa, known as onchocerciasis, or African river blindness. So a parasite enters the human bloodstream through the bite of an insect, and the vector responsible for the symptoms in humans is a parasitic nematode worm, which makes its way through the bloodstream into various organs, including the eye, where it reproduces, causing extreme pain and ultimately blindness. So more than 20 million people in sub-Saharan Africa are affected with this distressing and debilitating and life-limiting condition, which poses not just to them an obvious burden, an obvious handicap, but furthermore an economic burden on the people who are closely associated with them. So the story I want to tell you is about a chemical compound called imidepside. So it's an interesting compound if you're a chemist. It's isolated from a camellia, a flowering shrub. And a Japanese company was investigating this compound. They made some modifications, and they set about patenting it. So they got worldwide patents granted covering imidepside and various related compounds. And one of the observations they made is it has profound anthelmintic properties, which means it's active against worms, against nematode worms. So in the normal course of events, they sought a commercial partner, and they ultimately licensed the product to Bayer, a very large animal health organization. Well, actually a large chemical conglomerate with a substantial animal health business. And in veterinary use, obviously infection with parasitic worms is a huge problem. It's commercially significant. It affects commercially significant species, cows, sheep, pigs, and it's a huge market. And farmers will spend a lot of money on an effective product of this nature, which they duly did. The product was developed, Bayer invested hundreds of millions of dollars, and the product was brought to the market, where it's been very successful. Simultaneously, or actually subsequently, another division of Bayer and an organization, the DNDi, realized that the same product could be active in African river blindness, where the causative parasite had similarities to the ones affecting livestock. And they have developed this product as a treatment for onchocerciasis. And it is priced and distributed at a cost to ensure affordability in the 31 countries affected by river blindness. So there are several aspects to this story, but in the end, what it boils down to is a strong patent position enabled money to be generated. A strong patent position enabled a product to be developed. A second use occurred for the product, and without the money and the patent, it would have been impossible to develop the product for use in treatment of humans. So an economically significant problem led to the solution of a humanitarian problem, or the partial, at least, solution to a humanitarian problem. So what conclusions can we learn from the stories of the obstetric forceps, the Bayh-Dole Act, and imidepside? So patents are an important tool to bringing innovation to public benefit. They are not the entire solution. In certain circumstances, it might be undesirable from a social point of view to have too many patents in existence. We talk about exploitation, and when we talk about exploitation, we think about Victorian factories and children being made to slave away over hot machines. But exploitation in this context can include saving the sight of people in developing countries. And the final story is patents enable technology to be moved from where it is generated to where it is needed. So in this case, from a research facility in Japan to people suffering from a life-limiting disease in sub-Saharan Africa. And where is technology made? I'd like to leave you with one final thought. So here in Prague, you have a number of advantages. You have geographic advantage in the center of the continent. You have a number of world-class facilities. You have excellent infrastructure. And you have the people necessary to develop these technologies. And with patents and appropriate technology transfer, there is huge potential here, as I see it, for developing new industries, emerging industries, 21st century industries on the back of the intellectual capital that you have here. So that's all I've got to say. Thank you very much for your attention.